Hi everybody. This is the this is how it's insulin resistance when it involves toxic metals and chemicals. This is the cell signaling in the cells. Okay, if you take the surface of a cell, we have the insulin receptor on the outer surface of the cell membrane, and this is the alpha unit, and the beta unit appears this way. Okay, and then once insulin comes in here, it's insulin. Then it stimulates to form to join these two, where tyrosine comes in effect. Once this occurs, we have what you call phosphorylation on the surface. Once this occurs, we have the next complex called IRS. Okay, IRS complex comes in here. IRS1 complex comes in here. So then another phosphorylation occurs. This phosphorylation, we have another complex that comes in, is called PI3K. So there's another complex that comes in here. This is PI3K, and then what happens is you have a PIP2 that phosphorylates to PIP3, and then the next signaling pathway will be PDK1I. Okay, and then the next pathway will be PKT. In the PKT, it phosphorylates PKT to an active PKT. Here you have mTOR complex 2, and then this will have a downward signaling or upward signaling, where it releases a next signaling called glucose 4 transferase. This will allow glucose to come into the cells. So the question now will be, how do we know this occurs? This this is found through gas spectrometry or MRI techniques. Okay, all this is theory. For me, all this is theory. How do we know that toxic metals block, and how does it appear? Toxic metals can block here, and chemicals too can block here. Or you may have another complex called D tag or goes to become tag to PKC, and then you have overload of phosphorylation, and then it stops the formation or cell insulin resistance here. So it can disturb. So the key here is toxic metals. The question is, how do we know toxic metals exist in this cell signaling way? So the key here is that we can find toxic metals through oligoscan or blood tests, 3 urine analysis, 4 hair analysis, 5 S drive. Okay, so how does it appear on S drive? In the S drive, you can see a separate section of toxic metals appearing, and we can see chemicals. In the muscles, we can see leucine deficiency, isoleucine deficiency, and valine deficiency. These deficiency shows that indirectly at the signaling pathway, some of this pathway in the protein synthesis has been blocked, right? So the other way to look at it is we do free insulin levels, or some of you all do HSCRP. But if you do free insulin, you can see very high levels of free insulin. And as we are removing the toxic metals and chemicals, you can see the free insulin levels come down. Generally, when there is a lot of insulin resistance here, a blockage in the pathway, downward signaling or upward signaling, we in the medical practice will tend to increase medication. From 1 medication, we add to 2 medication to 3 medication. When these medications are not enough, we continue to give injection insulin. So the way to reduce and stop or overcome this insulin resistance is to remove these toxic metals and chemicals. Here especially the toxic metal that's influencing here will be especially like cadmium, right? Thank you. Bye.